I'm really excited for this expert insight. There is tons of information that is really relevant to you. I was lucky to bring in Corey Jacobs. Corey is a highly successful medical sales rep and a very successful sales trainer. He's an intelligent, thoughtful, methodical, hard-working sales rep. He is a kind person. He is very giving, and I really enjoyed our conversation, and I know you will too. He graduated from the University of West Georgia. He did not immediately become a medical sales rep, but he did jump into healthcare sales. He worked for a recruitment agency where he found his way into a position where he was actually meeting with the top executives of hospitals and selling them on the recruitment services. Having been in that space for years, he was then recruited by a medical sales company and took the leap, where he's been extremely successful. And 2 out of those 3 years, he's been a part of the President's Club, which essentially recognizes you for being a part of the top sales reps in the entire country. But what makes his insights so powerful is the fact that he started his own sales training company, an organization in which he consulted sales teams, both small and large organizations, to pay him tens of thousands of dollars to come in and speak to their team either for a day or for a few days, and had also online platforms and has trained countless people over the years. He has trained them on sales skills, mindset, and more. The more I talk to him, the more I discover. I still have more to discover, but there is so much information packed in our conversations. I'm really excited for you to listen in on my conversations with Corey Jacobs.
I think, just for your audience's sake, I think what you're doing is necessary. I think the content, from my perspective, use my 2 cents for what it's worth, nothing or something, is I've seen your content. It's really, really good, and it's necessary. Your blueprint from the decision-making series to the Get Hired series is really good. I think your audience should benefit tremendously from it, and I think you have enough folks like myself willing to talk with you that it's quite validated.
The majority of the people that I know that are in medical sales, they say when they got in, they got lucky. But at the same time, if you listen to the story, it's like they created their own luck by putting themselves in the opportunity to get lucky, to have that person reach out to them, or to have that person look out for them, and someone say, hey, you know, you'd be good at this, or let me put you in touch with someone. It's because they've done the work, they presented themselves correctly, or whatever it may be. So it's not like you were just walking down the street and just got a random email, you know. You did put in the work. But for someone who's looking to get into med sales, where do you feel, how should I ask this? Where do you feel is a good entry point? Like, is there a certain way to get in, or like how would you go about getting into med sales if you had no experience?
Well, first of all, I knew I wanted to be in medical device sales since I was out of college, so I was always kind of into it, but it just happened to do 10 years, 12 years later, but and I was in a good role. But yeah, I think a good entry point is focusing on the disposables is a great entry point in, because capital sales is a very difficult realm to get in. Even if you're a disposable, you've been in disposables for 20 years and you've had no capital experience, they still need you to get capital experience. The conundrum of med device.
Yeah.
You don't have med device experience, but you need med device experience to get into med device. But it's I think you need to understand that there are a lot of junior roles or associate roles out there, and I think disposables is a good way in, or areas where it's not so clinically product focused, like
Yeah.
there's lab jobs where you can go and pick up specimens, and there's so many ways in
Yeah.
that you can get exposed. Also, just getting healthcare sales experience is good too, whether that be tech, whether that be recruiting, whether that be EMR sales. Like, get into the healthcare space of sales. That's going to get you in better.
Yes. There's a young guy recently graduated from Kennesaw University, and I worked with him for a few weeks, and he just got a healthcare. He somewhat sells into healthcare. He's selling his company's offerings so that the hospitals utilize him to help bring in personnels on a third party basis. So whether it's like nursing or some sort of executive role that's open, he's doing essentially his recruiting and staffing. And he wants to be in medical sales, but he's smart enough to know, hey, let me take this because this company really wants me. I'm happy to be a part of it. I can take this lower wage, which is really just maybe 5-10 grand lower than he would for an associate med sales device role. And now he's in healthcare. He's in this space. And now he'll be able to meet people face to face. And within months or, maybe a year or two, he can then pick and choose what med sales role he can really dive into and actual sell products. And he'll have a better idea of what products he'd want to sell, whether it's surgical or maybe just wants to go to offices, whatever it may be. So finding that way in is good. Another route too is there's an engineer that I know, and she essentially does the maintenance of these technologically advanced products. Right? It's not a robot per se, but she goes to labs and she runs the diagnostics. And she's a tech essentially, and she wants to get into medical device sales. After a whole bunch of discussions and looking at different jobs online, we came to an agreement that the best thing for her is to be a clinical specialist or a product specialist.
Yeah.
Where she can go in, right, and manage this large piece of equipment. She has the intelligence to do it. People would love her because of her degree and what she's doing now. But she's also in the realm of selling. She'll be a part of a sales team, but without the quota. She doesn't have to sell because she's just the product specialist managing the machine. Then from there, she can comfortably move into med sales, selling after a year or two. But this next year or two is where she's going to be immersed in the world without the pressure of having to sell. So she loves that idea. She loves that concept. So seeing all these different routes in, there really are a lot. But from the outside looking in, it seems like it's a fortress. How do I get into this med sales world? And hearing your story is like, of course, you're selling to executives, right? Naturally, a med sales company is going to want you because you probably built. How many relationships did you build?
Yeah.
Just doing what you were doing.
My call points are much different now, but I still have some of those relationships. It's been a long time since I've sold into the C-suite in that realm, but I built a ton of relationships within large IDNs and systems. And what it taught me, even if I didn't carry the same relationships in this role, what it taught me is how to navigate the healthcare web. You know what I mean? It's very connected and disconnected, and so I understood how to navigate to get to decision makers. And so I carry those. I can build a relationship better now. It was very tough. I think the transition from consulting sales to med device was, I thought I made a bad decision because it was very difficult at first. But I stuck with it and learned the process and got very clinical on the products that I used and was able to find success. But yeah, there are a lot of ways in. My story, again, I felt like I was lucky and blessed to get reached out to, but I've been in healthcare sales for quite some time and had quite a successful realm. But if I could go to my younger self, knowing that I wanted to be in med device for a long time, I wish I knew what I know now in the conversation we just had. There's so many avenues in the med device industry that you could have started in.